Fat today in the face is one of the major factors that drives aging. It was once thought that facial aging was driven by tissue descent, and therefore surgeons were addressing the tissue descent with posterior traction pull, the open face lifting. Nowadays, we have learned that loss of the fat in the face is actually the major factor, and what we see as a descent is actually a pseudo descent of the face induced by volume loss. So it became intuitive that replacing the fat loss in our face had a crucial effect in our aging and in facial rejuvenation. We have published a technique of fat grafting in the face that is a modern way of doing it, consisting in utilizing a smaller fat, implanting it very superficially and in lesser amount. This technique is called SEFI, Superficial Enhanced Fluid Fat Injection, and you can see it published in the literature, in the main journal of aesthetic medicine, namely Aesthetic Surgery Journal. This is a new thing, but we have been doing it for over 2 years, and the satisfaction rate in our patient was very high, as was very low the complication rate. So basically, what is the new concept is harvesting a very, very fine fat, mixing it with our PRP, platelet-rich plasma, and combining the growth factor in the platelets with those present in this small fine fat, that is the adipocyte-derived stem cells, and placing it very superficially in the skin, where it provides the most effect. So we are now not only volumizing the facial fat loss, as we were doing with the bigger fat, but we are also regenerating the skin ruined by the aging, sun, smoke, whatever. So the combination of skin regeneration and fat restoration gives the face a wonderful effect with the same technique. The technique is simple as any other lipofilling technique. Under local anesthetic, small sedation, can be combined with any surgery. Endoscopic face lifting is my favorite combination, or blepharoplasty. Or it can be done isolatedly. The advantage of using the fat in respect of using fillers is that we have facial skin regeneration that is not provided by the fillers, and the effect is much more prolonged. We recommend that fat filling be repeated 1, 2 years, 4 years, when it's necessary. Each of us has his own metabolism, his own aging, depending on many factors that cannot be foreseen by the surgeons. But if associated with surgery, with any surgery, like let's say endoscopic facelifting, by addressing the volume loss and repositioning the tissue descent at the same time with small incision, you can see what profound effect our surgery has on the entire face with a small procedure. And the recovery time of this procedure compared to the traditional open face lifting is 10 times faster. It's less complicated, less risky. It's 10 times more natural, and my patient prefer that approach.